So thank you so much for the opportunity to present on behalf of the Family Solutions Program. Today, we are going to focus on the community-based programs addressing reproductive health disparities and maternal fetal outcomes. I know that you had an opportunity in the recent past to hear from Prisma Healthy Start, which we do some similar work. So I won't go through great detail on the similarities in our work, but you may hear some of those things repeated during this presentation. So the objective, which I pretty much already mentioned, but more specifically and formally, our objective is to increase awareness of the need for collaboration between healthcare providers and community-based organizations in improving outcomes. And just to level set, before we get into Family Solutions and the work that we do specifically, just wanted to remind everyone of the definition of infant mortality. And as you're reading that definition, some of you may or may not be aware of the recently released report by DHEC, which shows that there has been a decrease in the state of South Carolina in infant mortality rate. So now that rate is 6.8. But for purposes of Family Solutions, we focus on the disparity in those rates. So there still remains a disparity between the non-Hispanic white rate, which is 5.2, and the non-Hispanic Black rate, which is 11.2. And we also focus on addressing maternal mortality. And again, as you read the definition here for maternal mortality, and I'm sure that you all already know what that is, our state also has a legislative brief that comes out. And according to the 2024 legislative brief, pregnancy related mortality rate was 32.3. And this was a decrease from the previous report. But we, as Family Solutions, again, we always have to make sure that we give focus to the disparity, which is that the pregnancy related mortality rate for the Black population is 4.2 times higher than that of the white pregnancy related mortality rate. So, what's the point? Why mention those rates as it relates to Family Solutions? What do we do? What is our approach? So, for the next few minutes, I just want to share a little bit of information about how we at Family Solutions address infant and maternal mortality in our community based setting. So, as mentioned earlier, we are a program of the South Carolina Office of Rural Health. We are a community based program, but we do have a maternal and child health focus. We started off in '97 as just a Healthy Start site, but we have since advanced into providing a multitude of services, which includes Healthy Start, Nurse Family Partnership. We have a Family Resource Center, and we're also a supportive partner for Healthy Steps in the state of South Carolina. Our services are in 5 counties, 5 rural counties, which the majority of our state is rural. And those counties are Allendale, Bamberg, Barnwell, Hampton, and Orangeburg. This is a list of the people who make up our team. One of the unique characteristics of our team at Family Solutions is that we are from the communities we serve, which means we're either born there, we're raised there, we currently live there, or in a number of cases, we were participants of one of the Family Solutions programs. So within Family Solutions, we have the community health workers, doulas, childbirth educator, male involvement coordinator, healthy step specialist. We do consultation with a nurse practitioner who you'll hear from a little bit later. We have nurses through our Nurse Family Partnership Program, social workers, reproductive health specialists, and certified lactation consultants. Just briefly, our Healthy Steps work, we started working with Healthy Steps in 2021 within a family practice in Bamberg Family Practice. And the focus was to provide developmental support to parents of children from 0 to 3, from the age of 0 to 3. And so the services that we offer in our home visiting program is similar to the services that are offered in the Healthy Steps program, but these are provided in a clinical setting, within the clinical setting, hand in hand with the providers. For our home visiting initiatives, to start off with our Healthy Start program, there are 3 sites in the state of South Carolina. There's the one in the Midlands, which is Prisma Healthy Start. You have PD Healthy Start, and then you have us, which is Low Country Healthy Start under Family Solutions. We've been in existence again since 1997, and our criteria is pretty simple in that you just need to be pregnant or delivered a special needs or low birth weight baby and live within our service area. And one of the things that I wanted to highlight, since we did talk about the maternal mortality and infant mortality rates for 2022 for our state, I wanted to highlight that among our program participants, those people who enrolled in our program in 2022, our data showed that we had 0 deaths. And 91% of that population are recipients of Medicaid, and 93% are African American. So I always like to highlight those 0 deaths. For our Nurse Family Partnership home visiting program, there are approximately 7 in the state of South Carolina. We actually started offering Nurse Family Partnership services in Orangeburg County in 2015. And the criteria for our NFP site is that they must be pregnant with their first viable pregnancy, less than 29 weeks gestation when they enroll in our program. They must live in Orangeburg County and meet income requirements, which technically all of them who sign up for a nurse family partnership or have an interest in nurse family partnership are within those low income zip codes. And based on the performance report for nurse family partnership during that time period of October 1st, 2022 to September 30th, 2023, there was one fetal demise at term. Our home visiting process, it's a pretty simple process. We receive referrals from multiple entities. Our OB providers send referrals to us. We also partner with our managed care organizations in order to receive referrals. Once a referral comes into our program, into our office, we assign that referral for an assessment. One of our staff goes out, completes that assessment, and then a home visitor is assigned based on the findings from the assessment. As I mentioned earlier, we have social workers and we also have community health workers. So if the assessment calls for the needs, the services of a social worker, then we automatically assign a social worker, but then we also offer additional services as needed throughout their course in our program. We case manage for up to 18 to 24 months post delivery, and that depends on which program they are a part of. Our visits are primarily done in person, but we do also offer groups and virtual visits as well. So the work that we do at Family Solutions primarily focuses on those social determinants of health because we do not offer direct clinical care. So you all are very familiar with these social determinants. So I won't go through all of them right now, but I am going to tell you a little bit about how we specifically address each of those areas. The family solutions approach is rooted in the needs of rural South Carolina because that's where we are. And in rural South Carolina, we know that there are higher rates of unfavorable and lower rates of the favorable. So there are higher rates of unemployment, lower educational attainment, less access to healthcare and social services. There are higher infant and child mortality rates. And in the 2024 legislative brief, we saw that the pregnancy related mortality rate in rural South Carolina was 55.7 compared to 28.9 in urban. So those rates are higher in rural as well. I always like to include this slide because I like for our audience to always understand that while we do address the social determinants of health, our work at Family Solutions also embodies the understanding that there are layers to our existence. We understand and we consider all of the systems and the structures that our target population is born into. So there are things that were already in place before any of us were born. And as we go out to do our work to help to address the needs of our program participants, we try to take all of those things into consideration as much as possible. So now let me talk a little bit about how we actually address those social determinants of health. The first one that I want to touch on a little bit is education, access, and quality. One of the things that we feel very strongly about is early literacy. And so we promote early literacy through our partnerships with other organizations in the community. We have a community action network that is made up of like minded community organizations with a focus on improving the health and well being of our children, our women, and our families. And one of the areas that we focus on in early literacy is providing books to our program participants. When they enroll in our program, because of our partnerships, we're able to give them a book at the time that they enroll and at different periods during their pregnancy and after they deliver, we give them a book. And we also encourage reading during pregnancy, reading when the baby is born. Doesn't really matter what you're reading, but reading and using animation in your tones whenever you're reading to your children. We partner with school districts and institutions of higher learning. We offer scholarship opportunities to the people in the community as well as those who are a part of our program. And those scholarships are presented during our annual Infant Mortality Awareness Luncheon, which is held in September of every year. We offer those scholarships for people who may be looking to pursue higher education, or there may be some who are attending technical schools, who are going for a trade. We offer that assistance to them in those areas as well. And the picture that you see at the top, there's a little boy with a cap and gown on. We promote graduation. We applaud graduation ceremonies. We want the families to get excited about graduation. And our Family Solutions graduation brings out a large number of people from the community who just want to celebrate the success of these little babies at 2 years old, to just get them excited about excelling and learning. Because we know that education is one of the strongest predictors of overall health. Within Family Solutions, we also focus on the social and community context. Our work is not done in the office. We are in the community making connections and supporting those community efforts. We also focus on economic stability. We partner with credit unions to offer financial literacy workshops. We also help one of the largest manufacturing plants in Orangeburg County to recruit for employment. And then we assist with absorbing the cost of uniforms or the things that may be needed in order to start that first day of work. Our family solution staff is so heavily embedded in the community that we work with food security, food insecurity, by helping the local food share to pack boxes for distribution. And we are currently working on becoming a distribution site. As we continue, there is so much more that I would love to be able to tell you about Family Solutions, but I know that we are restricted with our time. So I'm going to move through this a little bit quickly. The next to the last social determinant that I want to mention is the built environment. And with built environment, I want to uplift our Family Resource Center. Our Family Resource Center gives us the opportunity to present a number of services to families in one location. The Family Resource Center is a flexible and family focused, culturally sensitive hub of support and resources where family members can come, community members can come and access those resources and not have to be concerned about some of the barriers that they have to overcome, which would be transportation or childcare, or things of that nature, because they can get a lot of things done in one setting. And the last social determinant, which is going to lead into our case presentation, is healthcare and access to quality, healthcare access and quality. As I mentioned previously, we are not clinical providers, but we work very, very closely with our clinical community to make sure that we are kept abreast on terminology, and the healthcare concerns of our state and the focus areas of our state. But one of the things that I wanted to uplift before we move into our presentation with our nurse practitioner is that we talk a lot about availability versus accessibility. And we want to make sure that we understand that availability refers to whether something is there to be used, and accessibility refers to how easy or difficult it is for you to use it. For the population we work with, some are either challenged with one or both. There may be providers available, but getting to them requires use of resources that the person may not be able to easily obtain, things like transportation and childcare. So we've created this group of clinical professionals, our Provider Action Network, who advise our staff on specific issues that our program participants may be encountering. And out of that group, we've also created a multidisciplinary team meeting where we meet monthly to talk about those concerns. And it's a fair exchange of information. We gain more clinical insight, and our clinical providers gain more insight into those social determinants of health.
Thank you, Lamikka. I think that your presentation was wonderful, and I think it really does